Now, you or someone close to you might have an addiction. It could be a substance addiction or a behavioral addiction, but would you know how to deal with it? Would you even encourage this person to come forward to seek help? Now, the fact is that many still believe that addictions are a moral wrong or something that only the weak-willed suffer from, and hence hesitate to come forward to seek help. I'm talking this morning with Professor Munidasa Winslow. He's a psychiatrist in private practice, and We Care Program Director Prem Kumar Shanmugam. We Care Community Services is a charitable organization that has just launched a new platform to raise funds for addiction recovery and to destigmatize addictions in Singapore. Now, Professor Winslow, you were saying earlier off the air that for every one addict affected, 5 family members are involved and affected as a result as well. This sounds like a pretty serious situation. I think also a lot of family members don't really know what to do in order to seek help. What is the appropriate form of care for a family member who might be addicted to a substance or to a particular behavior? So Prem, perhaps you could expand on some of the programs that are available to them that would make it accessible.
Okay, at We Care, we what we call ourselves, we run 3 pillars of treatment. One is called the recovery support groups, therapeutic counseling services, and prevention and outreach. Now, under the support groups, we run a couple of programs, to psychoeducational programs, educating family members as well as addicts in recovery on addictions. Now, under the counseling services, what we do is we have individual counseling, family counseling, and group-based counseling for addicts as well as family members. And we run experiential-based programs as well, also for addicts and their family members. Now, under the prevention and outreach, what we do is we go out and conduct workshops and talks and seminars to educate the public.
Now, you were saying, Prem, earlier that the stigma manifests itself in a lot of addicts not wanting to even disclose their condition, which is something that I can totally understand. I mean, if you were to tell your boss that you have a disease, an addiction, that can be rather difficult. It might make it difficult for you to advance in your company, so on and so forth. But I also know of some addicts who feel that if they could disclose such things, it would really liberate them. You know, is anything being done to perhaps increase awareness beyond just getting people to come to you for help? How about preaching to the people who may be unconverted at this time? And this includes corporations, family members, so on and so forth.
That's actually what we are trying to do right now. We are working with family service centers. We work with corporate organizations, and we're asking them to come and help us run programs and see what we do with the public. In fact, you know, there are so many people who are addicted, and they're actually professionals, and they can contribute to the society very well.
What is, you know, earlier we talked about what the recovery process involves, and Professor Winslow, you said that it is a long process. Don't expect it to be immediate. The results won't come so easily. But how can family members or friends help an individual through this process, through this journey?
I think they also need to take some understanding about the illness for themselves. And most people, again, have bought into that this is a habit or a moral weakness or something that you can just kick if you just have enough willpower. And it doesn't quite work like that for most addictions. Okay, most addictions you do need to actually be in some form of recovery process, recovery groups or individual therapy. And if you need to seek help, there are a lot of support groups out there for people or for family members of people with addictions. There's Al-Anon, or the support group for family members of alcoholics or alcohol-dependent persons. There's CODA, or Codependence Anonymous, and of course you can contact We Care. And now we understand that NAMS is also running quite a number of family programs. So going for CREST or for the family-free programs there or at We Care would also make sense.
Now, here's the thing, you know, you were saying we really need to understand the nature of the addiction. It is not just about the individual being weak-willed that makes him succumb to an addiction. So what really is it?
I don't think it's weak will, because you must understand that nobody starts drinking because they say that I want to become an alcoholic. Same way that nobody starts taking drugs because I want to be a drug addict. They take it because they have needs. And what happens is that within a short period of time of using, if it serves a purpose to that person, then they almost have something like a hijacked brain where their reward center starts to get more and more activated. They find it, the compulsion to use, stronger and stronger, and this makes it a lot more difficult to quit than just saying, okay, I will not use. Maybe in the early stages of any addictive process, you can still quit, but the longer you have allowed your addiction to carry on before you seek help, then it becomes a lot more difficult.
Does this process involve the administration of medication as well?
Usually, there are medications which can be used to help if there's a adjunct problem, a depressive illness or anxiety. And there's some medications that can help you quit or reduce your urges. But the keystone still is the behavioral and the cognitive kinds of therapies.
I've heard many people talk to their family members and say things like that, like, you must be strong, you must have willpower, so again it goes back to the whole argument of it being a disease of the weak-willed. How do we address this in therapy that changes that paradigm? Prem?
Well, I think, like Professor Winslow was saying earlier, it's pretty much like any other chronic illness. We must recognize that relapses and slips are common. They do happen. And when relapses happen, we accept them back again into treatment. It's not about...
It's a learning process. If you relapse, then you better learn something out of that relapse.
Yeah.
Okay, and you're going to need a therapist to point that out to you, right, in a sense?
Well, sometimes, because if it is the family, I've seen family members come and do slap therapy and whack therapy.
Does that work at all?
No, not usually. I think we know that it's been tried for a long time. Adverse events for an addict don't seem to work. So you can cane them, whack them, do whatever you want with them, and it does not change your brain. What really changes your brain is either medications that help, or especially the therapy that helps you to change the way that you think.
Okay, how can we take these efforts further? I mean, now that we're moving towards increasing awareness and getting people to accept this as perhaps a treatable disease, what more do you think we can do going forward? Prem, what are the plans?
One of the things, I think, destigmatization is very important. People need to understand that we are dealing with an illness here. It's not a moral weakness, or it's not a problem that because of willpower.
How do you plan on changing these mindsets?
Well, what we are doing at WeCare is we are going out now and conducting more workshops. We are talking to the public. We are educating the public. We have even started moving into schools now, starting with the kids in secondary schools and polytechnics. We have conducted some pilot programs with youth at risk, and the response seems to be very good.
All right, we'll continue to see how we can enhance these efforts. If you would like to know more, if you'd like to seek help as well, please go to this website, www.wecare.org.sg. Many thanks this morning to my guests, Dr. Munidasa Winslow, a psychologist in private practice, and WeCare Program Director, Prem Kumar Shanmugam.
938 Live. 938 Live gets you talking.